If you are over 60, there is a good chance at least one health myth is shaping your daily choices right now, and that myth may feel so normal, so familiar, and so harmless that you do not even question it anymore. That is what makes it dangerous. Not because it is loud, but because it is quiet. It hides in simple thoughts like I feel fine, so I must be fine. Or this is just part of getting older. Or I have taken this for years, so it must be safe. And the truth is, some of the biggest health risks for seniors do not begin with a dramatic moment. They begin with small habits, small assumptions, and symptoms people explain away for far too long. Today, I want to help you sort fact from fiction, because these dangerous health myths can affect blood pressure, memory, falls, sleep, medication safety, and the ability to stay independent longer. And there is one myth near the end that almost nobody talks about, even though it can quietly change everything. Source: I want you to hear my voice like I am sitting across from you at the kitchen table, not rushing you, not scaring you, just speaking honestly. Aging does bring change. Of course it does. But not every change is harmless, and not every symptom should be brushed aside. The goal is not to worry about every little thing. The goal is to notice what matters while there is still time to do something about it. That is where confidence comes from. Not from pretending nothing is wrong, but from knowing what to watch for, what questions to ask, and when to get support. That kind of knowledge can protect your body, your peace of mind, and in many cases, your freedom to live life on your own terms. The first dangerous health myth seniors still believe is this: if my blood pressure were high, I would feel it. This one is so common because it sounds reasonable. Many people expect high blood pressure to come with clear signals like a pounding headache, facial flushing, feeling shaky, or a strong pressure in the chest. But high blood pressure often causes no obvious symptoms at all. That is why it is often called a silent problem. A person can feel normal while extra pressure is still pushing against blood vessels day after day, placing strain on the heart, kidneys, eyes, and brain. And that is why so many older adults are surprised when a routine reading comes back high. They were not ignoring their health. They were trusting a myth. Source: let me give you a simple picture of how this plays out in real life. Imagine a man in his 70s who still does yard work, drives himself to the store, and feels pretty good most days. Maybe he gets tired now and then, but who does not? He assumes if his blood pressure were a problem, he would know it. Then one day at a pharmacy machine or a doctor visit, the numbers are much higher than expected. He feels shocked because nothing felt wrong. But that is exactly the point. High blood pressure often stays quiet until it has already been causing damage. That is why checking your blood pressure matters even when you feel completely fine. It is not about fear. It is about catching a silent risk before it turns into a bigger one. Source: and if you already take blood pressure medicine, here is the part many people miss. Feeling better does not mean you should stop it on your own. Sometimes the reason you feel stable is because the treatment is helping. If your numbers run high or low, if you feel weak, dizzy, or lightheaded, or if a new medicine changes how you feel, that is a reason to speak with your doctor or pharmacist, not a reason to suddenly stop or double a dose on your own. If a blood pressure reading is extremely high and comes with warning signs like trouble breathing, sudden severe headache, chest pain, numbness, weakness, vision changes, or trouble speaking, that needs immediate medical attention. Source: if this topic matters to you, stay with me all the way through, because the myths get more personal from here. And if you want, tell me in the comments how old you are or which of these myths you have heard most often in your family. I read those comments, and they help me know what you want me to cover next. If you care about healthy aging, safer medications, better sleep, memory support, and simple habits that help seniors stay steady and strong, subscribe and join me. My goal is to make this information calm, clear, and useful because older adults deserve advice that feels honest and respectful, not confusing or overwhelming. The second myth is one that leads to countless close calls. It sounds like this: feeling dizzy when I stand up is just normal aging. No, not always. Dizziness when standing can happen more often as we age, but that does not make it harmless or something to ignore. It can be linked to a drop in blood pressure when you stand, which is sometimes called orthostatic hypertension. It can also be tied to dehydration, medication side effects, low blood sugar, inner ear problems, heart rhythm issues, or other health concerns. And the reason this myth is so dangerous is simple. Even a few seconds of lightheadedness can turn into a fall. One missed step, one hand that does not find the counter, one moment of blurred vision. That is all it takes. Source: now think about how many times older adults stand up quickly in a normal day. Getting out of bed. Rising from the toilet. Standing after a meal. Reaching for the phone. Walking to answer the door. If you get that brief rush of dizziness, if your vision dims for a moment, or if you feel like your body takes a second to catch up with your feet, please do not shrug it off. Slow down. Sit at the edge of the bed before standing. Rise in stages. Drink enough fluids unless your doctor has told you to limit them. And pay attention to patterns. Is it worse in the morning? Worse after a hot shower? Worse after taking certain medications? Those details matter because they help your healthcare team figure out what is going on. Source: here is where many people get tripped up. They assume if the dizziness passes quickly, then it cannot be important. But quick symptoms can still point to something real. A temporary drop in blood pressure can still increase the risk of injury. A medication that makes you drowsy can still raise your fall risk. Mild dehydration can still leave you weak and confused. And in older adults, dehydration is not always obvious because the sense of thirst may be lower than it used to be. Some people do not feel thirsty until they are already behind. So if your urine is darker, your mouth feels dry, you are more tired than usual, or you seem foggy and off balance, hydration deserves a second look. If dizziness comes with fainting, chest pain, shortness of breath, new confusion, one-sided weakness, or trouble speaking, do not wait. Get medical help right away. Source: the third dangerous myth is one families often whisper without meaning any harm. It goes like this: memory loss is just part of getting older. This is one of the hardest myths, because there is a small grain of truth inside it. Yes, some mild forgetfulness can happen with age. It may take longer to recall a name. You may misplace your reading glasses. You may forget why you walked into a room and remember a minute later. That can happen to many people. But serious memory changes are not something to simply accept as normal aging. Dementia is not a normal part of getting older, and even before that, changes in thinking, judgment, or daily function should not be ignored. Source: let's make this simple. Forgetting where you placed your keys once in a while is different from getting lost in a place you know well. Taking longer to remember a word is different from being unable to follow a recipe you have made for years. Needing a calendar is different from asking the same question again and again in the same hour. And here is the part many people miss. Memory trouble is not always about memory alone. Sometimes what shows up first is poor judgment, missed bills, getting confused about time, unsafe behavior, or no longer taking care of meals, bathing, or medication correctly. That is why families sometimes say, "She seems different, but I cannot explain exactly how." Trust that feeling enough to bring it up. Source: I also want to separate gradual memory change from sudden confusion because they are not the same thing. Sudden confusion can be a red flag. If a person suddenly cannot speak clearly, looks confused out of nowhere, has weakness on one side, facial drooping, trouble seeing, severe headache, or trouble walking, that may be a stroke, and every minute counts. Even if symptoms fade after a short time, it still needs urgent medical care. Some people call that a mini stroke and try to brush it off because they feel better again. Please do not do that. A short-lived symptom can still be a major warning sign. Source: now let me tell you about a quieter reason memory concerns get missed. Many older adults feel embarrassed. They worry that speaking up means giving up control. They fear being judged, losing independence, or becoming a burden. I understand that fear. But asking for an evaluation does not mean giving up. In many cases, it is the opposite. It is a way of protecting your independence. Some memory problems are made worse by poor sleep, medication side effects, depression, hearing loss, untreated pain, low vitamin levels, infection, dehydration, or other medical issues that deserve attention. The earlier a person is checked, the more chances there are to understand what is happening and make a plan that supports safety and quality of life. Source: the fourth myth may be sitting in your home right now. It says if a medicine is over the counter, or if a supplement is natural, then it must be safe. This is one of the most common medication safety mistakes in older adults. A non-prescription sleep aid, an allergy tablet, an herbal product, a pain reliever, a stomach remedy, and a prescribed medication can all affect one another. Some combinations can cause sleepiness, confusion, constipation, dizziness, dry mouth, higher bleeding risk, kidney strain, or changes in blood pressure. The label may not warn you in a way that feels personal, but the risk becomes very personal when several products mix in one body. Source: I want you to picture a very common scene. A person has trouble sleeping, so they buy something from the drugstore. They also take something for allergies now and then, something for pain most days, and a few vitamins because they want to stay healthy. None of that sounds extreme. But together, those items may leave them groggy in the morning, slow their reaction time, worsen constipation, dry them out, or make them more likely to feel dizzy when they stand. Then they blame age. Or they blame poor sleep. Or they blame themselves. But sometimes the real problem is not age. It is the interaction between products that each seemed harmless by themselves. Source: this is why one of the smartest senior health habits is a full medication review. And I mean full. Not just your prescriptions. Bring the vitamins, the herbal supplements, the sleep aids, the antacids, the pain relievers, the cold and allergy products, and even the things you only take once in a while. Put them in a bag and bring them to your appointment. Ask your doctor or pharmacist to look at the whole picture. Ask: do any of these mix badly together? Ask: could any of these make me dizzy, foggy, constipated, sleepy, or unsteady? Ask: do I still need each one? That simple step can uncover problems that have been hiding in plain sight for months. Source: and please hear me on this. Never stop a prescription drug suddenly unless the healthcare professional managing your care tells you to do that. Some medicines need to be adjusted carefully. Some need to be tapered. Some are protecting you in ways you may not feel from day to day. The goal is not to fear medicine. The goal is to use medicine wisely. Good medication management is not about taking the fewest pills at any cost. It is about taking the right things, in the right way, for the right reasons. The fifth dangerous myth is one that steals energy, clarity, balance, and joy one night at a time. It says poor sleep is just part of getting older. Now, yes, sleep patterns can change with age. Some older adults get sleepy earlier. Some wake earlier. Some spend less time in deep sleep than they did when they were younger. But ongoing sleep problems should not be treated as something you simply have to accept. Older adults still generally need about 7 to 9 hours of sleep, and when sleep is poor, the effects spill into the whole day. Mood changes. Memory gets worse. Pain feels worse. Blood pressure may be harder to manage. Balance gets shakier. Blood sugar can be affected. A person who sleeps badly may start to feel like they are aging faster than they really are. Source here is what that can look like in real life. You fall asleep in the recliner after dinner, then lie awake once you get into bed. You wake up 3 or 4 times to use the bathroom. You feel exhausted in the morning even though you were in bed for hours. Maybe you snore loudly. Maybe someone says you stop breathing in your sleep. Maybe your legs feel restless at night. Maybe worry keeps your mind racing. Maybe a medication is working against you. Poor sleep has many causes, and that is exactly why it is worth discussing instead of dismissing. Better sleep can begin with small changes, but if the problem goes on for weeks or keeps hurting your daily life, it deserves real attention. Source, and here is the part many people miss. Sometimes older adults try to fix poor sleep by taking whatever seems easiest. A leftover pill. A stronger over-the-counter product. A supplement recommended by a friend. But if that choice leads to morning grogginess, nighttime bathroom trips, confusion, or dizziness, the sleep fix can create a new problem. That is why sleep and medication safety often belong in the same conversation. If sleep is poor, do not just ask what can knock me out. Ask what is causing this. Is it pain? Is it stress? Is it sleep apnea? Is it a medicine? Is it too much caffeine late in the day? Is it napping too long? Is it a mood problem I have not talked about? The better question often leads to the safer answer. Source, now I want to share the hidden myth underneath all 5 of these, because this one ties everything together. The myth is that small symptoms do not matter. This is the belief that if something comes and goes, if it is not dramatic, if it does not stop you completely, then it probably means nothing. But in senior health, small symptoms often tell the story early. A little more fatigue. A little more leg swelling. A little more shortness of breath when climbing stairs. A little more confusion in the evening. A little more dizziness when getting out of bed. A little less appetite. A little less thirst. A little less steadiness in the shower. One small symptom may not mean much by itself. But when patterns build, the body is trying to tell you something. I have seen many older adults wait, because they do not want to bother anyone. They say, I will mention it next time. They say, maybe it will pass. They say, I do not want to seem dramatic. I understand that instinct, truly. But bringing up a change is not complaining. It is good care. It is how problems get caught before they grow. It is how a medication gets adjusted before a fall. It is how a sleep issue gets treated before months of fatigue wear you down. It is how a blood pressure problem gets recognized before it causes real harm. It is how a memory concern gets explored while more support options are still on the table. So what can you do after this video if you want to protect your health without feeling overwhelmed? Start small and stay consistent. Check your blood pressure regularly if your doctor recommends it. Keep a short note of symptoms that repeat, especially dizziness, poor sleep, swelling, confusion, or unusual fatigue. Review every medication and supplement you take. Bring them with you if possible. Pay attention to sudden changes, not just long-term ones. If a symptom appears all at once and seems serious, especially chest pain, trouble breathing, stroke warning signs, fainting, severe weakness, or new confusion, seek urgent care immediately. For ongoing concerns, make an appointment and go in prepared. A few clear notes can help more than trying to remember everything in the moment. And for caregivers watching, I want to speak to you for a minute too. You are often the first person to notice the subtle changes. The repeated question. The unpaid bill. The extra wobble when standing. The unopened water bottle at the bedside. The sleepiness after a new medication. The strange quietness that is not normal for your loved one. Do not ignore your instincts. You do not need to accuse or alarm anyone. Just stay observant and compassionate. You can say, "I have noticed a few small changes, and I think it would be wise to ask about them." That kind of gentle honesty can make a big difference. The truth is, healthy aging is not about chasing perfection. It is about replacing dangerous myths with better habits and clearer thinking. It is about knowing that feeling fine does not always mean all is well. It is about knowing that dizziness is not something to casually accept, that memory changes deserve respect, that supplements and over-the-counter medicines can still carry real risks, and that poor sleep is worth talking about. These are not tiny issues. They are daily life issues. They affect confidence, balance, independence, and peace of mind. So if you remember just one sentence from me today, let it be this. Do not let a familiar myth make a real symptom seem smaller than it is. Trust patterns. Ask questions. Bring concerns into the light early. That is not fear. That is wisdom. And wisdom is one of the greatest strengths of growing older. If this script helped you, share it with someone who still believes one of these health myths, because one calm conversation can prevent a lot of trouble later. And before you go, tell me in the comments which myth surprised you most, or which symptom you want to understand better next. I'm Dr. Amelia Watson, and I want you to move through this season of life with more steadiness, more clarity, and more confidence, one smart step at a time.